Indiana's near-total abortion ban has complicated Indiana University's OB GYN program. Residents can't get required training in the state anymore, and that's left it to school leaders to figure out the logistics of out-of-state training. Aubrey Wright reports on how IU is working within the confines of the new law to educate future doctors.
Dr. Nicole Scott is facing new challenges as the leader of Indiana University's OB/GYN residency program. It's one of the largest OB/GYN programs in the Midwest. Based in Indianapolis, Scott leads training in areas like pregnancy management, childbirth, and reproductive health. That got more complicated after Indiana passed a near-total abortion ban in August. There are exceptions to protect a mother's life or in cases of rape or incest before 20 weeks. But where and when someone can get an abortion is strictly limited. That's a problem for IU medical residents. To remain accredited, OB/GYNs must have training in abortion care and pregnancy loss.
I think it's vitally important for our residents to have exposure to those procedures.
Scott says residents need this training so they're prepared when something goes wrong. Indiana has the third highest maternal mortality rate in the country, and it's getting worse. On top of that, miscarriages are very common. More than a quarter of pregnancies end in miscarriage.
An abortion procedure is just as safe as a miscarriage procedure and is the exact same procedure. And so if OB/GYN residents have adequate training in abortion procedures, they're going to be even more skilled with miscarriage management.
Scott and residency leaders found a solution. Send residents and faculty to Illinois for a 5-week family planning rotation. It's not easy to travel back and forth, and it's expensive, about $20,000.
They will typically go 2 days out of the week to perform procedures, and we will kind of fully fund their travel, lodging, and food.
Getting a license to practice in Illinois is also a hurdle.
But we had submitted applications as far in advance as 6 months before the rotation, and they still didn't have their license.
Dr. Kamal Kumar is a third-year resident. She completed the rotation last year in Indiana and will take it again as an elective. Kumar says the rotation was easier before the new laws. She didn't have to travel as far, and she felt safe doing her job. She was inspired to continue in family planning after her residency.
I think the main things that influence me are great staff that we have who are trained in family planning.
Kumar got the training she needed and an experience she loved. Experts worry that learners in restricted states won't have the same opportunities. North Carolina OB/GYN Dr. Jenna Beckham analyzed the impacts of abortion restrictions on medical education. She says best practices often conflict with what's legal.
It's a tremendous ethical conundrum, burden for physicians to carry, and particularly for junior physicians who are really early in their careers.
Beckham and her team expect training will lag in states with more restrictions. She says doctors likely won't want to live and practice in states with more restrictions. And care for pregnant women will likely only get worse.
What's that going to look like, 5-10 years into the future, where we have less and less physicians and providers who are able to provide full spectrum reproductive health care?
Kumar says she'll attend a fellowship in family planning after IU, another 2 years of studying. There's no options for that in Indiana, so she's figuring out where to head to next, keeping state laws in mind. For Indiana News Desk, I'm Aubrey Wright.